Hi, welcome to my podcast. This is Dr. Jaime Daniel, and today I want to talk to you about hydrocele. A hydrocele is a building up of fluid inside the scrotum. The scrotum is the skin sac that holds the testicles. Hydroceles are common in newborn baby boys. They usually go away by the time the baby is 1 year old. Older boys and adult men can also get hydroceles. We may define it by some other words, such as a fluid collection within the tunica vaginalis of the scrotum or along the spermatic cord. These fluid collections may represent persistent developmental connections along the spermatic cord or an imbalance of fluid production versus absorption. In rare cases, similar fluid collections can develop in females along the channel of neck by themselves. Hydroceles pose little risk of clinical consequences. However, the potential for more than fluid to appear within developmental connections between the abdominal cavity and the scrotum, or the association with underlying scrotal pathology, requires that hydroceles be evaluated with due prudence. A hydroceles usually does not cause symptoms except when it gets very large. When it does, the symptoms can include things like pain or discomfort in the scrotum, feeling as though the scrotum is heavy or full, swelling or irritation in the skin around the scrotum. Usually, the presence of fluid within the hemiscrotum has little clinical impact on the testes. However, determining the cause for the increased fluid, specifically any associated clinically significant pathology, remains the primary concern with regard to hydroceles. One pathology that is more ominous has been excluded. Persistence of the hydrocele or associated discomfort may indicate the need for surgical intervention. There are some tests that your doctor may use to help him to determine the diagnosis. One is named light test. Your doctor can shine a powerful light on the area of your scrotum where there is a swelling. If the light passes through, it means nothing solid is blocking the light. The fluid in hydroceles does not block the light, so if the light goes through that, it is good proof that the swelling is a hydrocele. We also get the ultrasound. This test uses sound waves to create pictures of the inside of the body. An ultrasound can tell the doctor if you have an hydrocele or a different condition. When we want to determine the cause, we need to talk about the pathophysiology of hydroceles, which requires usually an imbalance of scrotal fluid production and absorption. This imbalance can be divided further into exogenous fluid sources or intrinsic fluid production. Alternatively, hydroceles can be divided into those that represent or persistent communication with the abdominal cavity and those that do not. Fluid excesses are from exogenous sources, the abdomen, in communicating hydroceles, whereas non-communicating hydroceles develop increased scrotal fluid from abnormal intrinsic scrotal fluid shifts. Hydroceles typically manifest has a soft, non-tender fullness within scrotum. The testis is generally palpable along the posterior aspect of the fluid collection. When the scrotum is investigated with a focused beam of light, the scrotum transilluminates, revealing an homogeneous glow without internal shadows. Hydroceles typically manifest as a soft, non-tender fullness within the scrotum. The testis is generally palpable along the posterior aspect of the fluid collection. When the scrotum is investigated with a focused beam of light, the scrotum transilluminates, revealing a homogeneous glow without internal shadows. Hydroceles of the canal of Knock in female patients typically present as soft, non-tender inguinal or labial swelling. Like hemiscrotal hydroceles, labial hydroceles transilluminate readily. There are some indications for intervention in hydroceles, which include inability to distinguish from an inguinal hernia, failure of the hydrocele to resolve spontaneously after an appropriate interval of observation, inability to clearly examine testis, association of hydroceles with suggestive pathology, pain or discomfort, male infertility, and cosmetic. Well, just to remember once again, the treatment depends on what caused the hydrocele and what symptoms it causes. Treatment is not always necessary. Some hydroceles go away on their own, depending on your age, symptoms, and type of hydrocele. You might not need treatment. If a baby has a hydrocele that does not go away by age 1, he will probably need surgery to remove the fluid or the sac that holds it. Well, it was everything for today. Thank you for your time and listening to my podcast. We will see in the next episode. Goodbye.